as women, or as anyone, we try to take the power away from the birthing woman. And it's just, why are we doing that? I feel like even when it's a C-section, a lot of times we're like, oh, well, I didn't do any of the work. Well, you still carried that baby. Like, you still brought this baby into the world. That's the biggest thing, is giving them that power back, that they're the ones who did all the work for this.
Welcome back to another episode of the Beyond the Scale podcast. I am your host, Mary Katherine. And if you're new to the podcast, just a little background about me. At the young age of 26, I started as a member at a Fit Body boot camp, and it quickly became the best part of my day every day. And I used that passionate energy that I felt at boot camp to open up my own location in 2017. And today I have successfully opened multiple Fit Body Bootcamp locations and continue my journey with ownership as a mentor and an investor. I also serve as the community manager for over 250 Fit Body locations, and I am the proud host of the Beyond the Scale podcast. I'm super passionate about supporting our owners and clients to live their best life through prioritizing their health and fitness. I grew my career and my family together, two things that require a ton of time, something that we can never seem to get enough of. But being a mom is my most important job title, and balancing motherhood and work seems almost impossible these days. So thank you for joining us. Super excited to be here with you guys today. And I'm so excited about today's guest. She is actually local to me here in Virginia. And we have Dr. Kimmie Chernicky, and she is a certified pediatric and prenatal chiropractor, birth educator, doula, and entrepreneur who is passionate about all the things related to pregnancy, birth, and breastfeeding. She's also a wife and a mother of two, and knows from her own experience just how important it is for women to feel empowered as they transition into their new role of motherhood. Through years of caring for moms and moms-to-be, she has learned firsthand that if we change how a mom feels about and within herself at this important time, it can change countless lives for the better. Welcome, Kimmie, to the Beyond the Scale podcast.
Thank you so much for having me. I'm so excited.
Yes. So I just have to share with our listeners. So I originally met you through a mom group. It's called Huddle Up Moms, which is a local organization in our town. It's so cool. It's like this group of ladies, moms, professionals, a lot of like pediatric professionals, I'm finding, started this group together, and it's just a way to educate mothers and kind of like just advocate for how we're not in this alone, and how you have this support system in your backyard. It's just, you got to be willing to like go out there, put yourself out there and look for that tribe. And so Huddle Up Moms kind of does that. And so her and I met through that. And then I started following her just on all the social accounts and seeing all the cool stuff that she posted about like prenatal care and your pregnancy journey and breastfeeding, which there's just, again, never enough information about that. So I love what you advocate, and I'm so excited to be sitting here talking to you today.
Yes, this is going to be a great chat. I'm looking forward to it.
Yeah. So first I want to start with just like, tell me about, how did you get into what you're doing today, and what inspired you to become a chiropractor and specialize in like pre and postnatal care?
Yeah, so I guess the story is that I always wanted to be a pediatrician, but I didn't really know why particularly. As I got through college, I was like, okay, so I know I want to work with children. I've always loved working with children, and I want to work in healthcare. And growing up, the only exposure I had was pediatrician. So that was kind of my, like, I assumed that's what I wanted to do. When I was in undergrad, I took a class called Careers in Medicine. So every week they had a new professional in healthcare come speak to us. And there was a chiropractor, and he was just really vibrant. As he explained the philosophy of chiropractic, I thought that was a really cool concept about like healing your body from inside out, as opposed to the outside in model that a lot of medical professionals use. It was really cool to me, but I was like, I'm not really interested, because I don't really care about, not that I don't care, but I don't want to work with like old people, car accidents, and low back pain. Like, that's just not interesting to me. I want to work with kids, right? And so I I went through what I call my mid-college crisis where I was like, wait, I don't think I want to be a pediatrician anymore. And so I sat down and had lunch with him, and he goes, Kimmie, you know that there are chiropractors who specialize specifically with chiropractic or with pediatric, right? And I was like, no, but now I do, and I'm sold. And so it's just been that ever since. And my journey ever since then has been like started with the focus on pediatric care, but just learning more and more about how the health of a child really starts with the great healthy foundation for mom, preconception, throughout pregnancy, and then especially the birth. So that's really how I got as passionate about prenatal care as I am.
I love that. And I've really learned more about that over the years, especially during my pregnancies,
Yeah.
how, what I eat and if I move my body and even just my mindset, how that affects my pregnancy, my overall
Yeah.
well-being, and then how that's going to affect my child. And especially in
Yeah.
those first few months after you give birth, it's like, your health and your mindset is everything for you and that
Absolutely.
baby. It's like one of those things where you don't actually think about it too unless you're going through it. So even though you had the education, but me, I didn't understand it until I was going through it. So I think it's great what
Sure.
you're doing. Tell us a little bit about the importance of chiropractic care and like some of the roles that it can play during pregnancy, but not only for the mother, but for the baby.
Yeah. So, I mean, I guess there are two facets to this. One could apply to anyone, and your nervous system has two different modes of function. So, you've probably heard of your sympathetic, like that sympathetic drive, that fight or flight reaction. And so that's one side. I call that gas pedal, like everything's in overdrive. And then the other side of things that I consider your brake pedal are things where, like, your sleep, digestion, immune function, and hormone balance, that's where that really thrives. And so we have a lot of people who come into chiropractic care because of pain or like XYZ symptom, when really it's all about this overall, like, overarching global view of how is that balance in the nervous system. Are we more sympathetic driven or more parasympathetic, that gas pedal versus brake pedal? And pretty inevitably we find people are pretty geared towards one or the other, most commonly gas pedal, that fight or flight response. So getting good balance in there is really important. More specific to pregnancy, I like to think about like the pelvis and your uterus as a hot air balloon. So think about the bony structure of your pelvis as like the basket of the hot air balloon, and there your uterus is the hot air balloon part. And so all the ropes that tether the hot air balloon to the basket, those are all these ligaments and tendons that connect the two. And a lot of times we think, oh, if your uterus is tilted one way or another, it just is what it is. But a lot of times it actually comes from a misalignment in the pelvis. And so that's what's causing that to happen. So when you come into a chiropractor who is specifically Webster certified, and we'll talk about that in a second, who's Webster certified, they're not only going to adjust the bony pelvis, so that basket part, but they're also going to address the ligaments and tendons and everything that's supporting the pregnancy.
Oh, wow. So what kind of like symptoms can you have if just because I didn't experience that. So like
Yeah.
if your pelvis is like misaligned, I don't know what you would call it, what kind of
Yeah.
symptoms would you experience?
Some of the common things that women come into our office for would be things like sciatica. Pubic symphysis pain is a really common one that we see. Also, you have kind of your generic like low back pain and hip pain. Those are some of the common ones. But then some of the things that people don't think about are optimal fetal position. So, like wanting to have baby head down. If you think about like if you pull the tether on a hot air balloon and it makes the uterus like, twisted over, well, how is baby going to get into a good head down position when that's the case? So now if we unkink everything, it's going to allow baby into a better position.
That's so interesting because,
Yeah.
until learning more about this stuff, you always just think, okay, your baby's in that position and it might just stay in that position the entire pregnancy. And you
Hmm.
will deliver that baby however you have to get it out, whether it's
Yeah.
C-section, whether it's, a vaginal delivery. So that's
Yeah.
very interesting. At what point, as a chiropractor, can you tell like the position of the baby just like a, OBGYN can? Like, do you do the same thing? Like, do you do like an ultrasound or how do you figure that out?
No. So we definitely don't do ultrasounds. And, I tell all my patients that ultrasound is the only confirmatory way to know baby's position. I'll be upfront that in chiropractic school, they teach us what's called Leopold's maneuver, which is where we feel around to feel the different anatomy of baby externally from mom's stomach. There are a lot of, I guess, organizations in the profession who say don't do that. That kind of, crosses over into obstetrics. So we generally try to hold back from doing that. I mean, I won't say I'm not feeling around, but I definitely don't tell patients like, hey, your baby's head down, or, there's nothing confirmatory about that.
Have you ever had a patient come to you and like their baby is just not in the right position and they have like noticed a world of difference after their baby is and like their pain and just like the ease of their pregnancy? Do you have any stories like that?
Yeah, major difference. Yeah, it's just a major difference when baby's able to settle into the pelvis a little more where they're able to or supposed to. Usually mom can breathe a little
Yeah.
bit better. Sometimes that rib discomfort will improve because they're able to settle in a little bit more. But yeah.
Yeah, one of my good friends just had her fourth child, and
Yeah.
she was explaining to me how she was like on all fours delivering her baby like that because of the position, and they didn't
Yeah.
know that he was in that position until she went into labor. I don't know enough about what position he was in, but I was like, listening to her describe this process, and I was like, oh my gosh, like,
Yeah.
that was awful.
I love that she went into different positions because that's a cool thing about being mobile during birth is that a lot of times you will like if you're in a position where it's kind of causing to baby to get stuck, like with their shoulder or whatever, or maybe you're even starting to tear, you will instinctively move into a different position that will kind of prevent that from happening. So I think that's a really cool thing about being able to move your body and also like feel the things that you should be feeling during birth.
Definitely. I want to talk a little bit about, the benefits of chiropractic care for a mother and a baby after delivery. Before we get there, I want to talk a little bit about I know how you are super passionate about helping women feel empowered during pregnancy and just like
Yeah.
embracing the changes that their body is going through. Talk to us a little bit about how you do that and like even during that delivery process.
Yeah. Honestly, the biggest thing is I just give them their power back. So, little background story, which I guess I have to tell another background story to get to, but I'm like the queen of tangents. So, sorry about that. Background story is that for my first birth, we actually had an accidentally unassisted home birth. So, we were always planning on having a home birth. We did not plan to be just me and my husband at home during it. And so, it's one of those, like, I always make these jokes, like, she just fell out, like it just kind of happened. And I was a little in denial that I was in labor. And so I had someone in our realm, someone in our friend family circle who no names will be mentioned, but we were kind of hanging out recently and they go, oh, yeah, well, Jake delivered the baby. And I was like, no, I delivered the baby. And she goes, well, you know what I mean. Jake caught her. And I was like, no, I caught her. And so I think it's one of those where, like, as women, or as anyone, we try to take the power away from the birthing woman. And it's just, why are we doing that? I feel like even when it's a C-section, a lot of times we're like, oh, well, I didn't do any of the work. Well, you still carried that baby. Like, you still brought this baby into the world. So I think that's the biggest thing, is giving them that power back, that they're the ones who did all the work for this. Another thing is just reminding them that they are in charge of what happens during their pregnancy and their birth. I think so many times we go into pregnancy knowing that you don't know anything during pregnancy. Like, you don't know, unless you're someone like me who works in the pregnancy and birth world. Like, most women are walking into pregnancy not knowing anything, not knowing what to expect. And so you just like give up the reins and you're like, okay, tell me what to do. And that's really not what you should be doing. Like, you're the one in control. You're the one who should have the reins, right? And so I always remind women that they're the ones in charge. And a big thing is also reminding them of how to ask the right questions. You don't have to do everything that your OB or your midwife recommends. Like, you can ask, well, why would I do that? What are the benefits? What are the risks? Are there any alternatives? What if I just don't do anything? Or what if I wait a little bit? Like, those are the kinds of questions that I encourage them to ask when it's something that doesn't feel right for them.
Yeah, I love that because I do think today we are told, you should do this or you should not do this, but we're not often given the answers of why. And especially when we're going
Right.
to, a traditional doctor like our OBGYN, they're
Right.
telling us all these things to avoid, but they're not giving us the backstory as to why we should. And I love how you're telling your clients, like, just listen to your body. And like, it sounds like to me, you're probably really taking it case by case and not just giving everybody the same advice based on their
Yeah.
pregnancy. It's a very unique situation.
Well, yeah, and I mean that's what pregnancy is. Like I can't give the same recommendations to one person that I would give to the next person in the other room. It's completely different. And that's why I can't just print out a handout of, here are the benefits, here are the risks of an epidural because it's different for everyone. So so that's why I encourage people to have that conversation with their provider, whether that be an OB or midwife, that so that they can give the answers that are specific to their case. For example, I attended a birth a couple months ago where the mom had had two C-sections and now was trying for a vaginal birth. Well,
Mhm.
her benefit risk analysis was completely different to a mom who's a first time attempting a vaginal birth. So we have to have an individualized conversation with each woman.
Definitely, definitely. And something too is, when you're pregnant, you experience so much anxiety and stress because of all of the information that you're getting. And like for me, when I was pregnant with my first, I was so quick to go to Google for everything. Like if I had
Yeah.
one random symptom that wasn't, normal, it was like, I'm Googling it. And it can be the simplest thing to the most extreme thing. And it's like you're
Yeah.
freaking yourself out. And so, how do you help women deal with that? Just like the anxiety and stress that they have around being pregnant and watching their body go through these changes.
Yeah. So in our office specifically, we create a lot of space and content around these things that they are typically having concerns and questions about. So, like you said, you've checked out our page. So, like, you'll see that there's just lots of information about things that maybe they like. Sometimes you just don't even know what you don't know, right? Like, you don't know the questions to ask sometimes. So, just creating that content and like locally, we have workshops. Sometimes I'll do like lives on Instagram where we're covering those kinds of things. But we also take time at each appointment where, I mean, I think throughout each appointment, I say, do you have any questions or like anxieties about birth, about pregnancy? And, I'd say like 70% of the time the moms are like, no, I'm good. Or like they've covered it at some point. But sometimes they ask a question where I'm like, you've been holding on to that for a while, haven't you?
Mhm.
Like you've kind of held back on asking your OB about that, haven't you? And, so I think just creating that space for women to be able to answer those questions or ask those questions is really big for them.
Oh, definitely. I love that. How do you feel? So, I know with chiropractic care, you guys are super into exercise and nutrition and
Yeah.
just how, all of those fit together with your practice. How do you feel about exercise and pregnancy? Talk about that a little bit.
That is absolutely one of the best ways that you can prepare your body for labor. Ina May Gaskin, who's considered the mother of midwifery, she always said doing 300 squats a day would prepare you for labor. I always say that with caution because I'm like, I don't expect all our moms to go out and start doing 300 squats a day. But I feel like that just kind of ties in. Well, if she's saying that this is tremendously important, we should probably be taking it seriously. I think that the big key here is making sure that you're working with someone who knows the appropriate modifications for you at your stage in pregnancy. So like
Mm.
I worked with a trainer during my second pregnancy who she was like, okay, well, you're 12 weeks now, so we're going to do this. But once you hit 14, this is probably going to start changing. And I was like, I feel like I'm knowledgeable, but holy smokes, there's this whole new realm that you were just far and above beyond
Right.
me. So yeah.
Something I experienced in my second pregnancy was, I got to this point in my first pregnancy, I kind of went into it blindly. Like I didn't know much about it and I'm like learning
Sure.
as I go. But with my second pregnancy, when it came to exercise, I found myself in these different seasons throughout my pregnancy where I would have to ask myself, is this worth it and what's the benefit right now? And like for me, I used to love to run a
Yeah.
lot, like long distance. And I got to that point in my second pregnancy where about 12 weeks, entering into my second trimester, I'm like, is my body
Mhm.
really benefiting from this constant impact of running right now? Or should I be
Yeah.
walking for an hour instead? and really just
Yeah.
listening to your body and asking yourself, like, is this worth it in this moment? And I had to do that a lot. And I think that
Yeah.
helped with just overall mindset around my body changing and gaining weight and just like the state
Yeah.
I was in. Because I do think today, and you could probably speak to this, you see, especially on social media, these women saying, their body's not broken when they're pregnant. They can still do CrossFit and they can still lift all these weights, and which is great, good for them. But
Yeah.
that doesn't mean everybody should be doing that. And like, I was
No.
never a huge weightlifter, so I'm not going to do that during my pregnancy. Like, I did light
Right.
strength training, but it's like just listening to your body and not taking too much advice from outside sources when it comes to that, because like, it's your body, it's not theirs.
Yeah, definitely. Well, I mean, just like we talked about recommendations earlier, that every person and every pregnancy is so different. And you even experience like first pregnancy versus second pregnancy were different fitness wise. And I think that that's,
Definitely.
or I know that that's okay. And we have to just give ourselves a lot of grace when it comes to that. And like you said, listening to your body, not always listening to the gurus necessarily, like, listen to yourself first because you're the one who's pregnant. So,
Oh, definitely. And what about, so, after birth, the recommendation is always like 6 weeks, wait until 6 weeks and you can go back to exercising. What are your thoughts about that?
well, I mean, so it definitely varies greatly. So I think first line of defense here is to always check with your provider first because it'll depend on what kind of birth. And, but then there's the other end of things where like my midwife had told me that she had had a mom who had really tough mental health challenges. And the only thing that kept her sane was going, for a light jog. And she was only 2 weeks postpartum. And it was like, okay, do we want her to descend into postpartum psychosis? Or do we want her to risk a little bit of like postpartum,
Mm,
like perineal issue? You know, it that's where I'm saying it really depends mom to mom. So always check with your provider, but kind of the general is like that 6-ish week mark. Most women are kind of ready to start returning. You can do gentle walks before typically, but just being really slow and gradual with your return. Sometimes a good way to start is doing diaphragmatic breathing, just to kind of like calm and center yourself, relax that pelvic floor. Lots of benefits to doing that. And I think reminding yourself that you won't be able to jump right back into what you were doing
mhm,
pre-birth. It's going to take some time. Another really good resource I want to encourage people to look for is a pelvic floor physical therapist. They're a really great resource for knowing if you are ready. For example, things like running and jumping, usually that's a little bit of a longer timeline, more like that 12-ish week mark before we're really ready for that. So I just always say check with the professionals who really know their stuff, and pelvic floor physical therapists are like cream of the crop for that one.
Awesome, awesome. Well, Kimmie, thank you so much. We thank all of our listeners for joining us for another episode of Beyond the Scale. As always, please make sure you subscribe to our YouTube channel, follow us on Apple Podcasts or Spotify, and leave us a review. It is my goal to help educate our community on how to live their best lives in and outside of the gym and just spread the word of body positivity everywhere. So thank you for joining us.